Hello, my name is Mariah Jones, and these three are going to be my audience. Did you know that the first dictionary was published in 1604 by Robert Codry? And while it wasn't what it is today, it was considered to be the first dictionary of the English language with a focus on foreign roots. I was 7 years old when I was first introduced to a dictionary along with the rest of my classmates. We all shared similar feelings of excitement, nervousness, and a bit of fear, as a dictionary can appear to be quite large to a second grader. However, as the weeks went on and the students around me progressed in their understanding of how to successfully locate words in the dictionary, I found myself still feeling incredibly overwhelmed and having a difficult time locating words all by myself. And little did I know that this feeling was going to be carried with me throughout middle school, high school, into my first time in college, and even to now. It wasn't until I was 30, seeing my first Black female therapist, that I was diagnosed with ADHD. I felt a rush over my body. Again, similar feelings of excitement and nervousness, but most of all, I was really relieved. Because in that moment, I realized that all those years that I believe I was just not smart enough, wasn't that wasn't smart enough. It was that my brain is just wired differently and required a different teaching style. That day changed my life forever. I went from D's and F's to currently holding a 3.4 GPA and about to register for graduation for next spring, going on to get my PhD in psychology. One may wonder why it took so long to receive a diagnosis, and the truth is, history, racism, systemic and socioeconomic barriers are to blame. So, with that being said, today I'm going to discuss some systemic and socioeconomic barriers that Black folks face in receiving proper mental health care. But first, to understand the depths and the magnitude of these barriers, we must first understand the history of Black folks in this country and ask ourselves what Mary Addison asked: who are African Americans? African Americans are a resilient people who have endured centuries of abuse, displacement, marginalization. Their experiences are complex and multifaceted, shaped by historical trauma, ongoing systemic injustices such as the lack of access to proper and culturally appropriate mental health care, and the persistent pursuit of human rights. To understand who African Americans and Black folks are, it's essential to consider the psychological impact of their past and current circumstances on their introspection and their continued exhausting fight for justice and equality. The struggle is centuries long that continues to shape our lives and our identities. The legacy of systemic barriers in the US healthcare system has perpetuated disparities in access to quality care for African Americans and Black folks. While Black folks face racial disparities in all aspects of the health industry, it is hard not to draw our focal point to the disparities that they face when receiving proper mental health care. Despite having lower or equivalent rates of mental health disorders compared to white Americans, Black individuals often experience more persistent and severe illnesses. For instance, did you know that Black Americans are only 50% as likely to receive psychiatric treatment as their white counterparts for diseases of similar severity? Furthermore, among adults with a diagnosis based need for mental health or substance abuse care, 37.6% of white people receive treatment compared to 25% of Black folks. Provider discrimination, including biases and stereotypes, affect diagnoses and treatment decisions. The Black community faces significant challenges in addressing mental health due to historical and ongoing stigma, racism, and trauma. The stigma surrounding mental health in the Black community, as touched on earlier, can be traced back to slavery, where misconceptions about the mental health of enslaved people led to ignoring symptoms or downplaying their effects. This historical context has contributed to a culture that is fearful and uninformed about mental health. Did you know that the CDC declared racism a serious threat to public health? And research has shown that racial trauma can result from direct experiences of racism as well as microaggressions that add up over time. Black Americans are also more likely to experience PTSD. Did you know that our youth, nearly 65%, have reported traumatic experiences? Think about that. 65% of our Black youth have already reported experiences of trauma. The effects of systemic racism led to higher poverty rates, increased incarceration. You've heard of the school to prison pipeline. That's part of it. And reduced access to healthcare and housing. Barriers to treatment include lack of cultural sensitivity, mistrust of the medical system, and limited access to Black therapists. And limited access to Black therapists is exactly why I am in school studying psychology, because myself as a queer Black individual has had a very difficult time being able to find a therapist that, one, accepts me as a Black individual, and two, accepts me as an LGBTQ member and offers me a safe space to truly begin the healing process. Culturally competent care is essential in addressing the mental health needs of the Black community, excuse me. Therapists should acknowledge the harmful effects of racism, consider their own biases, and strive to learn about their patient's ethnicity and history. By recognizing the unique experiences of the Black community and working to reduce stigma and implicit bias, we can make a difference in the lives of those who need mental health support. The Black community often faces, in addition to systemic barriers, socioeconomic barriers, disparities, such as limited access to health, education, and economical resources, which can contribute to poorer mental health. Some examples may include limited access to healthcare facilities or specialists in certain geographic areas, high costs of healthcare services or insurance, underfunded schools or limited access to quality education, racial disparities in hiring, promotion, or pay practices. Socioeconomic factors can limit treatment options for Black adults in the US, with 10.4% of Black adults lacking health insurance in 2020. As somebody who spent majority of her life on Medicaid, as health insurance was not and still is not affordable for the typical American, it was incredibly difficult for me to find quality mental health care. As I mentioned earlier, I did not do well in grade school because I had no idea that I had ADHD until I was 30. I'm 33. It's only been 3 years that I've been able to be successful in school, only because I was able to receive the ADHD diagnosis and was afforded the opportunity to be able to look up different ways to retain information, different teaching styles, speak to my professors and let them know that I have ADHD. Only because I was able to have access to proper mental health care. And unfortunately, there are so many Black Americans who don't. Having done some research, I found in November 2024, the CDC had mentioned that 12% of both Black and white children were diagnosed with ADHD. But in another article published by Kelly Yang and others in the National Library of Medicine, mentioned that 50.6% of white children received ADHD specific treatments and doctor visits compared to only 36.2% of Black children. 50.6% of white students received treatments specific to their ADHD diagnosis, with only 36.2% of Black children. Now imagine if those barriers never come down throughout that child's life. They end up possibly receiving, an ADHD diagnosis at the age of 30. However, late diagnosis is not the only concern for Black folks, unfortunately. But biases that lead to the mistreatment or misdiagnosis of us. Moreover, the lack of access to mental health care can exacerbate existing mental health conditions, leading to increased symptoms, decreased quality of life, and increased risk of hospitalization. To address these disparities, it is essential to construct solutions that prioritize culture, excuse me, cultural competence, community-based care, and patient-centered approaches. This includes increasing the number of Black mental health providers, providing training on cultural competence and trauma-informed care. I cannot express and stress that enough. Trauma-informed care. And engaging with community-based organizations to promote mental health awareness and access to care. By confronting racism and constructing solutions, we can work towards reducing mental health disparities and improving the mental health and well-being of Black Americans. In hopes of you continuing your education on this topic, I want to ask you one last question. Did you know? Oh, so sorry. My name is Mariah Jones. And here's my audience. Thank you.